Time now for Morning Rounds with CBS News Chief Medical Correspondent Dr. Jon Lapook and dermatologist Dr. Francesca Fusco. First up, with temperatures rising and Memorial Day come and gone, this week we thought we'd focus on how to stay safe in the summer sun. About 5.4 million cases of non-melanoma skin cancer are diagnosed each year, and just over 76,000 cases of melanoma, the most deadly form of skin cancer, will be diagnosed in 2016. John, skin cancer, the most common cancer there is, but there are different types. What are the most common skin cancers?
Well, the most common ones are the squamous cell and the basal cell. Those are the ones that you see very commonly because of prolonged skin exposure. There are millions of them a year. They tend to be less deadly. I mean, they can be a pain in the neck to get rid of, and you can have a need for special procedures. But the one that's really deadly or potentially deadly is melanoma. And the key thing there is to pick it up early and to do steps to prevent it. We're seeing a rise in melanoma, especially in young people, especially in young women. So today is all about how do you prevent it, how do you pick it up early?
Well, it's good that we have you here. So what do you tell your patients when they come in, especially if for self-detection of melanoma? What should they be looking for?
So we use the ABCDE rule. A stands for asymmetry. Look for any mole that appears to be asymmetrical. A mole should be a mirror image. If you draw a line down the center of it, one side should mirror image the other. Border, the border should be smooth, not scalloped or jagged. C, color. Make sure that it's an even color throughout and not multiples of color. D is diameter, anything larger than 6 millimeters, which is an eraser on the end of a pencil. Really focus in on that. E stands for evolving. Is it something that's been changing? Has it been growing, changing shape? And then something new that we added, which I call the ugly duckling. It's referred to as ugly duckling because it's a mole that really stands out. You're looking at your back, you're looking at your chest, and there's one in particular that stands out.
So ABCDEU.
Yes, there you go, you.
And it can be hard to really notice any kind of a change, especially if you're living alone or if your vision isn't very good. We've talked about this before. Francesca happens to be my personal dermatologist, so I trust everything she says. And she pointed out the fact that there are some tricks. If you're living with somebody else, maybe once a month when the woman is doing a breast exam, well, take out a flashlight. Right. And maybe a glass of wine or something, and just examine each other. And you have to look where the moon don't shine, right?
Absolutely. Every nook and cranny, everything has to come off. Sometimes you can make a game of it if you have children. You can make little maps and measure them every month and keep track of everything. But what's most important is constant surveillance. And what John said about if you do live alone, ask your hairdresser as you're getting your hair cut to look through your scalp to see if they notice anything. If you're going for a massage, mention to the masseuse. Let me know if you see anything there.
Is there anybody, John, who might be at special risk for melanoma?
There are people who have had previous history of melanoma, people with a family history of it. If you've had multiple blistering burns as a youth, we looked it up, and the most recent figure is if you've had 5 blistering or bad sunburns, you double your risk.
Oh, wow.
Yeah, if you have freckles, if you have a lot of moles. It tends to increase with age, and yet we're seeing this increase in people who are younger, too. And that's probably from a number of factors, maybe tanning beds.
Ozone layer.
Being destroyed in the past. It's being replenished now, but the effects of the past.
I have to say, though, I feel like on behalf of every brown person, I think sometimes we falsely believe that we are out of this discussion, that it's not really going to affect us.
But it is, and that's a myth. No matter what color your skin is, you are at risk for melanoma. And related to that is some people believe that when they get a sun tan because of the pigment that it confers on the skin, or even using self-tanner, that this serves as a base that protects them. That's false.
And you gave me another trick, which is for women, remove the nail polish, right? When they go to the dermatologist, because she can't see otherwise.
All right, well, now that we all know that sunscreen use is important, but a recent survey shows 88% of Americans still have experienced sunburn, and 71% say they have suffered moderate to severe cases. So there are a lot of myths, John.
Right.
Let's start off with the SPF myth, because a lot of people believe 30 is double the protection of 15. Do the numbers correlate in that manner?
Not exactly like that. So 15 gives about 93% protection from the sun rays, and 30 gives about 97%. What's important is that it's broad spectrum, so it's UVA and UVB, and also that you reapply every 2 hours at least the
At
FDA
least
says.
every 2 hours, and be very generous with your application. If you think you've applied enough, apply a little bit more. Studies have shown that people are not really applying as much as they should, so they may be getting 1/3 the protection that they should be getting.
Francesca, what are the keys here then applying sunscreen?
Apply it every 2 hours. Use a broad spectrum sunscreen. Make sure you apply it all over in places that you wouldn't think of. Inside your ears, go close to the hairlines, between your toes. You can get a melanoma between your toes. So everywhere you have skin.
And sunglasses.
And sunglasses, because you can't apply sunscreen to your eyelids. So make sure you wear UV protectant sunglasses.
Doctors Jon Lapook and Francesca Fusco, thank you both so much.